Now, Justin just warned us that the weather's going to get dicey later on this afternoon into tonight. It's great to have Dr. Alicia Arbaje here with us with some simple weather tips here for our people that are a little bit up there in age here. Thank you for joining us.
Thanks for having me.
All right, I got a whole list here. First off, frostbite and hypothermia. You got to prevent that.
Be very careful. When older adults get older, it's harder for them to regulate their body temperature, so they're less able to know that it's really cold, and they don't produce as much heat as younger adults. So it's really important to be careful when they go outside.
All right, they go outside, and how do they know that they've been hit with hypothermia?
Right, so it's very difficult. Sometimes it's not them that knows, and it's the person that's with them, so it's important for them not to go out alone. But things to look for besides the obvious, which are shivering. Shivering is one sign of hypothermia, but if you don't have it, it doesn't mean it's not there. But other things to look for are pale skin, cold skin, or red and painful skin. Also, if they start to get confused, if they get tired, if they start not making any sense or slurring their speech, actually acting as if they're having a stroke, that can be a sign of becoming too cold.
All right, you go over to their house and you see mom in a sweater.
Yeah.
Right? You go over the next day, she's in a long, one of those real big coats. You notice that the thermostat's way down.
Right. So what we often recommend is that people should be at least at 65 degrees. I mean, that sounds really cold to me, but at least 65 degrees in the house to prevent at least a sudden drop in body temperature. And then we also recommend that people wear several thinner layers of clothing, not the one big thick layer. It's a lot easier to stay warmer if you have several layers, so you can have some air trapped along the skin to keep you warm.
All right, let's talk about, of course, the falls. That's what we're falling on icy steps. We're falling, slippery floors coming in with our boots.
Exactly.
How do you prevent this?
So this is such an important issue. Falls are really important for older people all year long, but it's especially important during this time of year for a few reasons. Remember that older people are on medications that can make them more likely to fall. We just heard about herbal supplements and problems that can happen there. But some of the medications that older adults are on, sleeping medications, medications for allergies, people with sinus problems in the winter, they take medications for decongestants. All of that can make them more likely to fall. And so it's very important for them to be very careful about the medications that they're taking during this time of year. But more importantly, wearing good shoes with non-slip soles, and then when they go outside, making sure that if they have a cane or a walker, that the rubber tip at the bottom is in good condition. You can even go to a medical supply store and get an ice pick attachment to put at the end of your cane so that you can walk more easily outside.
And if you have somebody up there in age, go over and help them out, right?
Please. Yeah, and if you're an older person, please check with your doctor first before going out and shoveling the snow, because people can have heart problems when they go out there or lung problems. Much better to have someone else shovel the snow and clean out that walkway so that they don't fall.
Well, let me ask you this. If mom calls and says, I just slipped on some ice that was right on the door, how do you know between the slip and a stroke? How do you know the difference?
Yeah, so you don't necessarily know the difference right away. So if the person falls and is sort of normal after they're done, so to speak, after they've done falling, if they don't have any new problems, like a new problem with their leg or their hand, then probably it's more likely a fall. But one thing that's really important is that people tend to say, oh, I just fell, it's no big deal, I just got back up, I'm fine. But a fall is a sign of another problem, usually of 2 or more problems in an older person. So when someone falls, they need to go and report that to their doctor so the doctor can do a checkup to make sure everything's okay.
All right, doctor, she's good. And she brought your mom in. Hi, Mom.
Hi, Mom.
There she comes in.
To actually say that on TV.
Hi,
I love
Mom.
it.
All right, hi, Mom. All right, thank you very much.
Thank you.